Welcome to the DNA Talks podcast, where we take on the mission of unlocking the code of your genetics. This season is all about you, upgrading your health, not just on the surface, but down to the root cause. Join us as your clinicians at the DNA company investigate your DNA and beyond. The intention of this podcast is to enhance your lifestyle by changing what is in your control. This does not substitute the medical advice given by your personal doctor, therapist, and other healthcare professionals.
Bonjour, bonjour, bonjour. Welcome, friends. It's wonderful to have you here this evening. I'm so elated and excited for the conversation that we're about to have. I hope this all finds you well. I hope you were dancing alongside us, because I know my presenters today were. I would like to welcome to our midst Dr. Adilia Sapp and Dr. Tiffany Smith, both practitioners at the DNA company and people who are very focused and passionate in the space of mental health and how genetics can interface with it. Welcome, ladies. It is a delight to have you here this evening or afternoon, depends on where you are. I'm calling it from California today, so it's still an afternoon, I believe, for me. Where are you guys?
I'm in the greater Seattle area, so same time zone. It's still mid-afternoon, although quite dark here, so feels a little bit like evening.
Yeah, and I am in Las Vegas, Nevada, so we're all on the West Coast, Pacific Standard Time today.
I'm going to very briefly allow these women to introduce themselves and how they support mental health within their practice. Dr. Sapp, Dr. Smith, I'll allow the Canadian traffic jam of who goes first of politeness, but I wonder and I ask if you could each introduce yourselves, what sort of practice you have, and how genetics has started to be folded within it, how its power is starting to shift how you're approaching people and the care that you offer them.
Yeah, absolutely. I can start. I did start at the DNA company back in its infancy, back in Mississauga, when we were making supplements by hand. Not actually, don't worry. They were safe and all. But when the DNA company first started. So I started in mental health back in my internship in 2017 in Toronto. I've had a clinical focus on mental health and cognitive health since then, as well as an intersection there with genetics. And I'm currently in family practice. I'm a family physician here in Washington, and I do have a focus on mental health. It does help a lot to know what your genes are. So unfortunately, not all my patients can get the coverage to get their genes tested. But when it comes to the naturopathic and dietary changes and implementation, in terms of where the issues are coming from, it definitely can guide the practice. And I've seen a lot of examples of that. And I'm sure Dr. Smith can speak to that further.
Yes, I am Dr. Tiffany Smith. I'm an integrative and functional psychiatric nurse practitioner. So a big mouthful there, right? But at the end of the day, my belief was that more could be done in the mental health space than just medication. So I assess, diagnose, and treat mental health conditions as that of a psychiatrist, but I am the nurse practitioner version. And I felt that more was needed to stop the revolving door of mental health, that we really needed to start getting to the root cause and treating really why we are there, why you're having those symptoms, what's really going on. So with my journey with my husband, decided not to utilize Western medicine for his chronic pain, which led to other conditions. It led me into functional medicine, lifestyle medicine, and integrative medicine to understand how to actually get to that root cause. And in doing that, adding the genes has just been profound because it gives a layer of understanding of who you are. In traditional psychiatry, it's okay, SSRIs, a selective serotonin reuptake inhibitor. But what if you're not creating serotonin? What if you are holding too much serotonin already? Those things aren't taken into consideration. It's just, if you're sad, you get the anti-sad pill. If you're sad, if you're anxious, you get the anti-anxiety pill. And so by understanding how you work, how your body is made, now a treatment can really be personalized to you. And then with the additional functional components and testing, we get to the root cause and treat you well and help you to live a life based on you, giving you health independence. So I love partnering with clients in that way. And I'm out in Las Vegas, Nevada, like I mentioned, and licensed in the states around me as well. And I just offer overall health and wellness by utilizing the genetic component as well. I think it's the one thing that's missing in our health and wellness.
I value, I'm scanning right now who's here, and I value the wealth of information that both of you are going to bring to the conversation tonight. Because as I heard it, neither of you said baby or bathwater. You said, how are we going to work with this? And then on top of that, let's add in some genetics. So I'm really excited for this conversation. It sounds like there's quite a few practitioners / nerds in the audience. I wear that as a badge of honor. So please extend my compliments to you. So we'll allow the conversation to speak to some practitioners to get to that nerdy level, but we will still hold an honor reverence to those that are perhaps coming to the end of, I'm really struggling with anxiety, depression, whatever it is. The only option I'm hearing about is the anti-SAD pill. What are my other options? So we'll make sure we show up to our audience tonight. So I wonder if we can start off with clinical experience that either of you have that speak to, here's how someone presented to me, and here's how I leveraged both holistic integrative practices alongside genetic awareness of the person to shift how I went about treating them. Yeah, Dr. Smith, I wonder maybe we start with you because you shared a very powerful story when we were doing the huddle just before this, when we were kind of aligning on what do we want to talk about.
Yes, I had a client come to me that stated he felt that he had ADHD. His dad was just diagnosed with ADHD. He feels he has ADHD. He can't stay on task, can't sleep, can't focus, and has been irritable and angry and just put me on meds, you know? And oftentimes when clients come to see a mental health provider, they've tried it all, they've done it all, they're out of options, they know they're going to get put on prescription, so they're at that level. And he was there. And I said, well, wait a minute, you know, and I explained how I work and getting into the root cause of things. And we did the genetic testing. And what we found was that his genetic markers for mental health was actually all fine. His challenge was that he had issues with detoxification. It was in his liver and his gut that caused him to have presenting symptoms that looked like ADHD. And that was so profound because now he saved a lifetime of being on stimulants, starting on Adderall, then increasing the dose, and then adding medications for the side effects because you can't sleep. And now you don't have an appetite, and just all this lifetime of let's try this and swap that out. We nipped all of that in the bud by getting to the actual root cause of what's going on, optimizing nutrition, lifestyle, supporting the liver and gut to help him lead the life he wanted to lead. And we didn't have to bring in those things. They weren't required or necessary for his case. So I think that was huge. And I always tell that story because it's so profound in really getting to the root cause and how it can really help you get to live in your life sooner than later.
Yeah. I love that story. Sorry, Dr. Sapp. Yeah.
I love that story. Sorry, I just had to interject because it really aligns with my clinical experience as well. Just even when it comes to something like ADHD, we don't even know where it comes from, right? One of the most associated genes would be dopamine, and we could look at DRD2, we could look at other dopamine genes, we could look at COMT in terms of impulsivity and hyperactivity. But at the end of the day, it can come from a lot of different places. And I've had experience with patients who've had mold toxicity or mercury toxicity, and they've presented with new adult onset ADHD, which we were taught isn't really a thing. You're supposed to have it when you're a kid. But now for some reason, there's all these young adults that suddenly have ADHD. And then that's when you have to ask questions like, where is this coming from? Is this, a dopamine deficiency, or is this an exposure? And really looking at the different areas of people's genes is very helpful in guiding that process because it's kind of like your blueprint, and then you can do further labs after. But to know which labs to test, it often helps to start with a gene. So I really like that example, and I think it's a really good one. So in terms of like patients that I've seen in the past, I used to work a little bit more in functional genetics as like a consultant, and currently not all my patients are doing genetic testing, but just to give an example, a little bit of an anecdote, if it's not too much of a segue from the DNA company back in the days, we used to, among our staff, and we were always confidential with client information, we used to share some of our genes in the cognitive section because we thought it was interesting to compare and discuss temperament and cognitive styles, and something that section of the report, the cognitive and the mood section, can tell you and is strongly correlated with is temperament. But what you do with those specific predispositions can be the difference between having mental illness or not having mental illness, being low functioning or high functioning. And that is where the epigenetics and just the beauty of these reports comes in, because there's so much to work with. And there's also so much hope, even if you don't have the genes you wanted to. So
I wonder, this would be where I'd love to offer an anecdote, right? In particular to the end of genes can be worked with, right? Having a gene does not mean you are going to have an outcome. Very rarely does it mean that. And so what I would offer, and this was, a consult I took maybe 5 years ago, and it completely changed the way I approach patient care in regards to genetics and explaining thereof. So in advance of our consults, we'll go over someone's genes in large part because, as Dr. Sapp has mentioned, it really tells us about a disposition of a person. And the person coming into me, from a mood and behavior perspective, to a degree, could not have been more suboptimal. They were this perfect storm of everything was suboptimal. And so I was expecting a consult that would have been really difficult, scattered attention, very anxious and or depressed, kind of not able to focus and compute nor want to, right? And I was really expecting a difficult consult because talking about genetics with someone who is struggling in that space can be difficult. And this woman comes in and she is composed, collected, focused. And when I said, here to see me today for, it was something completely irrelevant. It had absolutely nothing to do with mood and behavior. And my first thought was like, okay, maybe I got the person's genes wrong. Maybe I looked up the wrong person. And I'm waiting for that proverbial shoe to drop. And as we progressed, we addressed her concern at the very end of the consult. I said, hey, how are you feeling? You've expressed really well today. And I was really digging, let's be plain. I was digging to figure out, where's this person? Did I mix this up? And eventually what came out is that this person had been raised by a therapist, and mental health discussions within their home were very commonplace. Feelings were encouraged. And further to that, more interesting to that, how do you approach feelings? How do you ensure they don't take over your life? How do you use them as constructive things as opposed to destructive things? Was a central conversation. And so she had a lot of tools. And her comment to me, which was so interesting, she's like, I'm frustrated that I need to exercise all of those tools almost every day compared to my siblings who only maybe exercise them when, the proverbial ish has hit the fan, and, they need to use it because it's more stress that's imparting them with struggle. And so this person, this is important for people to hear. If your genes say you're not optimal, there are things that you can do in light of that to work with them. This woman happened to be serendipitously born to a therapist, right? The toolbox was given to her from birth, but it's not inevitable. These can be worked around, right? They can be supported, and knowing that directs how we go about the support, which is very interesting to me, right? As a clinician, to an extent, it fine-tunes where you need to focus. Yeah.
That is such a good example. Although being born to a therapist does not always work that way. But as a personal anecdote, being born to a psychiatrist does not always work that way. However, I know a lot of other children of therapists, but that was a beautiful example. I've seen the exact same thing. Because I've done a lot of at least short genomic consults from back when I was with the DNA company and after coming back. But I've seen people who've had across the board optimal cognitive health and mood and behavior. And because of life circumstances, because of trauma, because of lifestyle, because of potentially socioeconomic factors. And this is why I talk about the biopsychosocial model. I just talk about that. It's hard to escape, right? People say, oh, but I thought you could just go to a therapist. Yeah, that's great. Oh, but I thought you just needed meds. Yeah, you might. Oh, but I thought, well, you need to address the biology, the psychology, and the social aspects, right? So anyway, so we had another person that I was working with where it was the opposite, like your story, Krista. Everything suboptimal. I was shocked when I saw, their samples, and no, there was no sample failure. Those were their genes, and they confirmed it, and they were familiar, and they grew up in a supportive environment. They should have had, just based on their genes, I expected them. And these aren't clinical genes, just so everyone understands. They're genes where we can kind of modify the outcomes. They're not directly associated with different illnesses, but there are correlations. So this person grew up in a structured environment. I thought they would have had ADHD and been an extreme risk taker because they had like fast comped, they had low dopamine, they had like genes all over the place, and nothing. Perfect focus, perfectly level-headed. They happen to practice mindfulness and have a relatively stable upbringing and numerous other factors working in their favor. And they also worked at it. So yeah, we see that all the time.
Yeah, that's awesome. Real quick, that's where when you have this knowledge about how your genes are, and you put those lifestyle factors into play, you don't have to have the Xanax, an Ativan. You're learning how to calm the nervous system, calm the body on your own. And that's what we all want, right? But sometimes life happens and we need something now. But while you are addressing now the best way you can, even if that's with Xanax or Ativan or what have you, you're learning these other lifestyle factors. You're learning you. And these genes help you understand you so that now you can take control and it doesn't take control of you. And that's what I took away and wanted to add.
Yeah. As a personal anecdote, I remember the first day I got my genes back, and I had a bit of grief. I had a bit of shock. I was across the board, other than BDNF, suboptimal in mood and behavior. But it really helped me understand where things were coming from. I finally accepted the fact that I had higher sensitivity to my environment. I accepted the fact that, I may have some tendencies towards ADHD, but I don't have hyperactivity, and that there's ways to manage it. And it just gave me a greater understanding and acceptance of myself and my predispositions, as well as giving me some tools to change that. If we have slow comp, you might want yerba mate over green tea, for example. Yeah.
We're unpacking a few more of the specifics here because we have a few practitioners, we have a few self-identified nerds. I wonder if we can start unpacking a little bit insights that we can gain from test and really scoping out the limits of the test too, because I want to be very plain to the audience. This is not a test that will diagnose a psychiatric condition. This said, it is a test that will guide how treatment can be offered and guide how therapeutic relationships can best be offered and where you want to focus in regards to calming that nervous system. So why don't we start unpacking that a little bit? So I would offer the statement, our test is spectacular on the spectrum of anxiety, depression, focus and attention, as well as general, to your point, addictive sort of tendencies or lack thereof, right? Why don't we unpack a little bit how that might show up in clinic, how that might show up in people?
Yeah, I mean, in terms of concrete examples for, the nerds in the audience, or the people who have their reports, or the people that want, some of the specifics. The first one I thought of was 5-HTT-LPR. SSRIs tend to be a really common go-to Band-Aid in psychiatry, and even in primary care, and not everyone responds well to them. I see them as kind of SOS emergency medicine for, really difficult life circumstances that may cause overwhelm. If someone's in a position in life and they're drowning, that's often a place for them. And I don't know what you would say about that, Dr. Smith. I'd be interested. But one of our genes here tells us that you may not be a good responder to them. And so that was just the first concrete example that I thought of.
And I'm with you with that. I think that we have to not go medication first. If you're in distress, if the house is on fire, we need to put some water on that and we need to calm that down because you're not going to go anywhere or do anything until the fire is out if you're really struggling emotionally and mentally. And while that is working, then we're testing, getting those results back, and then we start to add in the lifestyle and nutritional implications based on the findings. So, looking at maybe like depression, you have people that have dealt with depression for a lifetime, and all of these medications have never worked. I mean, just from a child up through adult. And when you take a genetic test and learn about MTHFR, BDNF, and how your body responds to that, that's huge. That can be the thing that stops, and now in functional medicine, we're also looking at allergens and gut health and all of these other things as well. And when you put that together, now your supplementation isn't a shot in the dark. You know exactly, okay, I have an MTHFR deficiency, which is the folate metabolism, and my BDNF, which is your brain-derived neurotropic factor, is lower, which is the neuroplasticity, the resilience. We say your mental health resilience, for example, to shorten that. There's ways we can support and supplement that, adding some folate, adding some vitamin B12, having some omega-3 fatty acids, encouraging exercise. We always know that exercise is good for us. But oh my gosh, we don't know in all of the way our dance, we don't know all the ways that it is. And it improves our brain resilience, our mental health resilience, that BDMF. It improves your mood. And we even talked about some other ways exercise improves you as well. So that's where the genetics gives you just that extra secret sauce to make all of this make sense, and helps you. Now it empowers you to take control of your health because you understand where you are. There's nothing wrong with you. It's just how this world is supposed to adapt to you.
Yeah.
Good way of putting it.
So let us then kind of come back again to that unpacking of, let's draw the connection between genes and either a full outright mental health condition or things that can kind of be masking as a mental health condition. Because I think I very much personally empathize and identify with, sometimes I get rolling anxiety, but it's not because of my genes. It's because of I do not detox. My body got an IOU for those sorts of things. And so I can tell when my body is dirty, i.e., a little overwhelmed by the physical environment, because I start to get anxious. And it took me a long time to make that connection. For a long time, I thought I was anxious. And actually, it's no, just my body's dirty and needs to be cleaned up a little bit.
And yeah, that's such a good example. And anxiety would be a good one to start with, because it pretty much relates to all of the genes in the cognitive section and a few other sections. So if you start from the top, if you start with COMT, which is a gene that creates an enzyme which helps break down catecholamines like dopamine and norepinephrine and serotonin, then slow COMT is more correlated with anxiety than fast COMT. If you just look at the genes in isolation, that is. And then if you look at ADRA2B, that one affects your noradrenaline response and your fear response, and can make you more prone to PTSD, as can COMT. So the suboptimal variations would make you more prone to anxiety as well. So if you go through all the genes, they kind of affect anxiety in different ways. And hence the point that looking at your genes first can really guide the direction of your treatment plan. Because if it's more related to, I'm overwhelmed by toxins right now, like I am like surrounded by pollutants and I've just had a mold exposure and I just like ate a bunch of sushi and it's all colliding all at once and I have this anxiety, you may move more towards some milk thistle or glutathione or sauna or whatever your strategy is, versus get a prescription for Prozac. So it really helps to know kind of where it's coming from. Anxiety can also be related to the cardiovascular section even of the report. That one is a bit of a stretch, but if you're, having an acute cardiovascular issue and you have suboptimal genes there, it could be related. If you have poor methylation and you're not metabolizing folate and you have suboptimal MTHFR and 3 other genes in that area, maybe you need some B vitamins. Maybe you need some anti-inflammatory agents through diet and supplements. So those are just a couple of examples. And Dr. Smith, you can just roll with this one because anxiety can come from so many different places.
Correct. Which is why you don't want to just give out these medications just haphazardly. You really want to get to the root cause. I like to empower in what I do. And so by me having this understanding, then I can empower people on the education of how to eat if you have anxiety and how helping you get in touch with you. I do resiliency training so you can know how to build you and be resilient to life and what's happening. And so, yes, so this is my empowerment tool that helps me to build and build and empower the community, the population to be the best that they can be and not have to worry about being addicted to benzodiazepines, not having to worry about a lifestyle on ... You know that if you're on these medications, it is absolutely because it's necessary and not just because it's just a Band-Aid or something that's an easy throw at you. And that's what the DNA tests do for me, is to take me through the journey you just went through, Dr. Sapp, to get to the treatment plan for you. Your lifestyle plan is what I call it. How you're sleeping, who you're with, what's work like, what are your relationships, what are you eating, what triggers you, everything down to where you breastfed or bottle fed. All of that comes into play and giving you that full treatment plan. That's the power of the genetic testing and then adding the functional medicine aspect as well. It goes together.
Yeah. One of my, while I by and large don't do pediatric support, mine tend to be more adult clients. One of my favorite groups to work with, just more from a passion heart place, is parents who have swabbed their children. And the reason I say that is it helps them understand how their child is formed up in the world and helps them embed those lifestyle things in from an early age. So for example, if we know you have poor BDNF and are a little bit more subject or at risk for kind of internalizing trauma or being hypersensitive and having that racket, knowing that can change the way you approach your parenting and supporting of that child compared to, right? Like if you don't detox well, you need to focus more on keeping that clean environment. And I think, it's I see often a lot of these consults that I do are not because the child came to me, but because I worked with the parent. And then the parent is like, I want to know how you work so I can guard and support all of this and teach my child when you're stressed, these are healthy, good ways that you can respond because you're going to be weakest in this way.
Yes, I agree. I treat parents because the kids would break my heart and burn me out. So I believe in treating the parents to treat the families.
Yeah. And I stayed away from pediatrics until recently, but because the rate of adolescent mental health in the US has just skyrocketed, and I don't know what the statistic you last saw, Dr. Smith, was. I saw at one point recently that about 1 in 2 US teens may have a mental health condition. So I've started slowly transitioning into that population as well, just because there's so much need for it and so much demand. And it does relate to this conversation of like partially epigenetics and changes that are happening. And the fact that anxiety, depression, ADHD is not just a disorder of the mind. I think we've moved beyond that. It's also a physiological change that occurs in the brain and the body. So just recognizing that connection between the brain and the body and the nervous system that connects it is where looking at these genes and seeing how they affect mental health comes in. So
Mhm.
Yeah, and that is ultimately what got me into naturopathic medicine. I don't know about you, Krista, but at one point I wanted to be a psychiatrist, and then I ended up studying psychology. And then I got really tired of just talking about psychology and the brain when I knew that part of it was related to the body. So basically, your diet, your supplements, your lifestyle, they all have an effect on mental health conditions, and every little bit counts, essentially.
Yes.
Yeah. Yeah.
I say that mental health is everything and everything is mental health because it's all connected right back to
Yeah.
our mental health and well-being.
Yeah. Yeah.
Yeah.
And I think it's so beautiful now that now that we've kind of divorced ourselves from the idea that mental health sits just within the brain, right? Now that we acknowledge there's an element of socialization and how the world engages with us. There's an element of the toxicity within the world. And there's a huge element of diet and lifestyle, right? I think one of my more favored studies around how important something can be was it was a study within a psychiatric inpatient facility. So these are people who their conditions have put them in a space where it's best for them to be tended within a facility, right? And the intervention they offered here was simply encouraging, enabling, and empowering people, these patients, to get 8 hours of sleep. So tools and tactics, et cetera, compared to not. I think they got, material on something else. I forget what the control was. But simply by engaging in good sleep practices, right?
Mm-hmm.
The people were able to decrease the severity of the presenting condition. It did not get rid of it. Let's be plain, right? Solutions are going to be multifactorial. It's not going to be if you sleep 8 hours, you're going to get rid of a full-blown psychiatric condition, but they were able to reduce reliance on emergent medications. So kind of medications that are put when a person is unable to control themselves and at risk to themselves, right? And they were also able to get further and move further within other therapies and other modalities because their body was in a space where they were able to work with it. And I've heard this both from Tiffany, Adilia, both of you. You've said medications have a place, but it's usually to the end of putting out that fire so that you can start the true work, right? So they're not bad, but they're also not the fix often.
I would agree. Yeah. Yeah. And I see that a lot where just like little tweaks like that, like for example, I've had young patients who don't realize that you need to eat protein to produce amino acids to help your dopamine production or to get amino acids to help your dopamine production, to help your ADD symptoms and to help your mood and stuff. And so protein, I don't know if you would agree, Dr. Smith, is like a pretty big part of an anxiety diet, like increasing protein, understanding that it's important, especially a lot of young women I find end up not eating enough protein. And things like vitamin D, it's associated with ADHD, it's associated with anxiety and depression. And there's a gene, that'll tell you if you're more likely to have vitamin D deficiency. If you live in the Pacific Northwest, you probably do. Maybe 50-50, but if you're not taking it, but that's a good chance. And so the genes can help you with those physical factors, which can in the end be the difference, right, between being well and not being well. So yeah.
And being matched with a really good practitioner who will hear you and then is able to consider the different areas. So, for example, just going back to the concept of protein, I was plant-based for a long, long time, about 25 years. So I got referred a lot of people who either were or wanted to become. And I started to see, especially within that group, a high prevalence of depression, anxiety, and simply listening to the diet. By and large, it was a deficiency of protein, right? So once we simply shifted that, that's not to say that diet is bad. It's more to say when a diet is not properly implemented, in particular for the person before you, everyone needs a little bit of a different diet. It can and it can create situations where you think you are depressed or anxious, as that being the root cause, as opposed
And
to
also, right. And to your point, your genes would also play a role there. Like, if you have suboptimal methylation across the board and you're not methylating efficiently, that would increase the chances that a vegetarian or vegan diet might not be right for you. There's some
Right.
people that it could work for, but your genes are an important factor. If you're half Eastern European and you have bad methylation across the board, maybe genetically that wouldn't be optimal. So, it helps to know where you come from. So, yeah.
Yeah. And I'm seeing quite a few. I want to acknowledge there's quite a few questions in the chat, either privately or more publicly, where people are saying, hey, I'd love to work with one of the practitioners, Dr. Smith in particular, getting a shout out from actually someone I know, and I think you two would be a really good connection, Yvonne. If you are interested in working with any of the women that you're seeing before you or separately, someone at the DNA company, just shoot us a quick email. We'll make sure we connect you properly. We want to make sure you're enabled to the best care, whatever and however that looks like for you. And I think just the breadth and the depth and the personalization of medicine can be so important, and the game-changing factor, right? The more we know, the more we're able to empower you with information, the better the end outcomes are going to be. Really, the answer to tonight's entire webinars. There's a lot of factors. It depends.
We like to treat individuals, not algorithms, right?
That's right.
Oh, look at you, prospect. I want to just offer my incredible gratitude for you coming this evening. It's always a treat for me to get to present and to speak with you, plainly because I get to learn something every time that we chat. And I thank our audience as well. We're talking about some things that really have only come into medicine as real conversations maybe in the past 5-10 years. So snaps, kudos, incredible gratitude to you as well for jumping into these conversations, in particular in the more sadly bleeding edge way of it's not just about the brain, it's many different factors. So huge kudos to you. We have the best audiences out there. We have the best questions, and we're so grateful to you ladies, to everyone out there. And so I think it's time we say adieu, au revoir, and perhaps we dance out, because that's how we support our mental health. Yeah.
And thank you so much, Dr. Kostroman. I love speaking with you, Dr. Smith, and I'm so grateful for the audience and the DNA company and that we get to work in this space.
That's right. And see, we are all helping our mental health with gratitude. So everyone, thank you. Thank you for joining. Thank you for having me. And I wish everyone the best mental health, and just dance out. The world is yours. It's your oyster. You can have it. Whatever you think and believe, it's yours.
Love it.
Mommies and me's.